Thank you, Nick. And thank you, Sarah, for sharing your research and findings with us. It's really wonderful to be here this morning with you all, joining in this room, as well as you joining via webcast. My name is Kira Fothery. I'm a senior policy analyst here at the Bipartisan Policy Center. To continue the conversation and hear from people who are on the ground really generating and using evidence to inform programs and policies, we're very fortunate to be joined by these three panelists. Beginning on my left, Jessica Corvinus is the Manager for Research and Evidence-Based Policy Initiatives for the Colorado Office of State Planning and Budgeting. Eric Trupin is a professor and the Director of the Division of Public Behavioral Health and Justice Policy at the University of Washington in Seattle. Eric was instrumental in developing legislation that requires services to be evidence-based in the state of Washington. And David Yoakum is the director of the lab at DC. David was previously a founding member of the White House's Social and Behavioral Sciences team and Director of Scientific Delivery Unit at the U.S. General Services Administration. Thank you all for being here. Pleasure. To begin the conversation, I'd like to ask each of the speakers to offer some brief background. Jessica, please tell us about your office.
Sure.
And your role, and we'll pull up a slide for you.
Great. So as Carrie mentioned, my name is Jess Corvinus. I have a really long title. We're still working on how to shorten it, but I am the Research and Evidence-Based Policy Initiative Manager for the state of Colorado in our Governor's Office of State Planning and Budgeting. And I already have a long name, so the long title just adds to it. But we do have a slide with our timeline. So I can't see it totally well, so hopefully I get all of the dates right. But as you can see, Colorado has a long history of data-driven initiatives and evidence-based policymaking. So starting in 2011, Colorado implemented our LEAN initiative, if people are familiar with that. Really building on how do we create more efficient, effective government. And then building off of the success of LEAN and the LEAN initiatives, we actually were able to pass legislation in 2013, the SMART Act, which is the State Measurement for Accountable, Responsive, Transparent Government, which really formalized our performance management tool and that process into legislation. So every year, state agencies are actually required to submit a performance plan with their vision. That really established that in our state government. And then I'm going to take a moment and really talk about 2014, which is really our foray into the evidence-based policymaking space. So a couple of things were happening in 2014, but I will say most importantly, the Results First initiative came to the state of Colorado. So that's actually when I came to the state and started working in the governor's office. So Results First initiative was actually jointly funded by the legislature and the governor's office. So myself and my colleague were actually hired on to implement and populate the Results First model, and we were mandated to look at three policy areas, so adult criminal justice, juvenile justice, and child welfare. So again, I used to be the Results First project manager. That used to be a really nice short title, but we have since expanded our work to this broader research and evidence-based policy initiatives, and I'll talk a little bit more about that. But we've since expanded our Results First model, and we've essentially completed every policy area, run benefit cost analyses, done program assessments through the Results First model. So we've published 5 different reports, and that's really kind of what got us into the evidence-based policy space. Although we were able to do those program assessments and run our benefit cost analysis, really what we recognized during that process is that a lot of programs fell outside of what we considered evidence-based by our standard, and we wanted to understand, well, what else can we be doing? I know we've talked a little bit more about evaluation. That's really important in our state, so we really recognized that we needed evaluation supports and implementation supports, and that's why we've since expanded our work to become the Research and Evidence-Based Policy Initiatives team versus just focusing on the Results First model. So that was in 2014. That was a big year for us. A couple of other things that I wanted to highlight on this timeline that we're really involved with with as the research and evidence-based policy team is we also brought Pay for Success into our state in 2016. So we've worked hand in hand with our Pay for Success project manager, who also sits in the Governor's Office of State Planning and Budgeting, and have really focused in looking at when the proposals came in, we put out what we call a call for innovation, which is a little bit different than a request for proposals or a request for information. We really wanted to hear from the communities what they thought would impact different youth outcomes. We're focused on crossover youth, so those that are served by multiple systems. And so we helped look through those proposals, assess the level of evidence for the different programs that came through, and then we're evaluating all 3 of those proposals that were selected through rigorous evaluation. So we helped with that evaluation design, kind of thinking through that. And then in 2017, we established the Colorado Evaluation and Action Lab, which is one of these policy labs that was mentioned earlier, which is really focused again on bridging that gap between the academic community and state government. And instead of it kind of being the academic community saying, hey, we have this really great idea on what we want to study, it's actually working in partnership with state government and state government agencies saying, hey, we have this problem we want to fix, we want to know more about this, how do we work with you to get rigorous evaluation done? And so our team is also really heavily involved with the Evaluation and Action Lab. They actually have oversight of the governor's office. So we created the priority areas, but it's them working in voluntary partnership with the state agencies to really determine what projects are going to be moving forward. So that's kind of the landscape and the background of where we are. So I've been in the governor's office for 4 years now, and it's been a really exciting journey. We're excited to see what happens at the end of 2018 and going into 2019. So.
Great, thank you. And Eric, could you tell us about your work in the state of Washington?
I'm actually standing in for, excuse me, a legislator named Mary Lou Dickerson, who was instrumental in initiating and engaging our state and our legislature in interest in evidence-based practice. We're really fortunate that there's been a long history in interest in outcomes, and it's primarily, or the primary interest was driven some 20 years ago when our state was on the verge of initiating a major expansion in corrections and juvenile justice. Build more beds was the idea. We're having this incredible increase in youth crime and adult crime, and the expectation was that we ought to invest in strategies that would have an impact on that. Somewhat at the same time, progressive legislators were interested in establishing an entity that would actually look at the outcomes of policy, and established a organization called the Washington Institute of Public Policy. So one of their initial studies, one of their initial projects, was to do a meta-analysis of outcomes for youth as well as adults as a function of what the intervention was. Were they placed in a secure placement? Were they provided with some type of intervention? And the meta-analysis was very, very profound and persuasive to legislators that it wasn't really a good idea to invest in new prison beds and juvenile justice settings, but there were all these alternatives, all these different community-based programs that showed not only good outcomes as it relates to recidivism, but being that this institute had a number of economists involved, they had fabulous economic effect sizes. So this sort of built an appetite on the part of legislators for, let's look at evidence before we make some decisions about where we're going in terms of policy. I was very, very fortunate to be working with legislators who in fact had an interest in what are the outcomes for kids, particularly kids and adolescents in behavioral health, mental health, and substance abuse, juvenile justice and child welfare. This was really driven from, we don't have good outcomes. We have 60–70% recidivism rates, particularly for black and brown kids in the juvenile justice system. We have what is perceived as poor outcomes for children and youth and families who are involved in behavioral health. And in child welfare, permanency planning in terms of outcomes of children returning homes really was not where it ought to be. So there was an interest in could we do something else? Are there programs, are there interventions that might in fact improve outcome? So this really was in Washington State, legislatively driven, and we're really fortunate, well, I'm fortunate, being that we're the only university that does extensive healthcare training in Wyoming, Washington, Alaska, Montana, and Idaho. So there's been a long history of a relationship between policymakers and university types. And this is prior to thinking about things like implementation science. There's a lot of crossover. People are legislators and legislative staff are talking to us about what we might do to impact improved outcomes for kids and families. So if I have probably the second slide, we had a piece of legislation, again, bipartisan legislation. So the interest here was not on one side or the other. There was a tremendous amount of interest on the part of our legislators around outcomes. And some legislators were much more interested in economic effects. Are we throwing money away? Are we misusing taxpayers' money? And other legislators were much more interested in what is the social impact of implementing evidence-based programs. And I'm thinking about Sarah's slide on the four attributes that contribute to effective evidence-based practice. We had a very dynamic and enthusiastic group of legislators who were interested in this. We had providers and families and youth and individuals who had been impacted by interventions that were effective. So there was a constituency that existed that could go and support legislation. And the original legislation laid out some guidelines, which also established within our university an evidence-based practice institute. The expectation was to work in collaboration with government, in collaboration with providers, on implementing, expanding the use of evidence-based practice, expanding the workforce that would be able to implement those evidence-based practices, as well as evaluating the effectiveness of those practices. You go to the next slide. Legislators felt over the course of the time between that original bill, House Bill 1088, and the subsequent years, the process was moving very slow. There was not a lot of data coming from state government, from the executive branch, from the various divisions that were responsible, being able to demonstrate that they actually were implementing evidence-based practices. So a bill was put together, which is a very, looking at other pieces of legislation, very authoritative in nature. It required us to develop definitions for evidence-based practice, create an inventory of evidence-based practice that the provider community could use, and then to hold the provider community responsible for, over the course of years, implementing these evidence-based practices. The inventory, you could go to the next slide. I don't think you could see it, but the inventory exists on the Washington Institute of Public Policy, as well as our Evidence-Based Practice Institute website, defines evidence in evidence-based practices research-based practices and promising practices in very specific ways. And the way we defined evidence-based practices, not only on the basis of clinical effect sizes, but also economic effect sizes. Did they actually save money for government in terms of implementation? We based this inventory not just on what the research, obviously on what the research showed, but we obligated ourselves to look at the sample size of the research and to make sure that it aligned with the populations of Washington State. Washington State has approximately a 30% minority population. So in order for a program to be deemed evidence-based, it required that it had a sample size that represented what Washington State had. Much of this, as this legislation was being developed, the provider community was particularly concerned about resource allocation, about if you are going to hold us responsible for implementing evidence-based practice, there needs to be some reallocation of the structure of how providers are paid. So much of our work has been done with individual providers around how they could orchestrate their budgets so they in fact could buy, purchase, implement evidence-based practice. In addition, we were interested in also engaging in a discussion about promising practices. So we have three categories: evidence-based, research-based, and promising practice. And it was really very important to engage the provider community in what do they, from the wisdom of the provider community, what do they think they can do to make this occur, or what are they doing that they think could move up the evidentiary chain, and work closely with them to affect that. Sustaining interest in evidence-based practices is not only an ongoing issue. It requires a great deal of attention, lots of feedback about data, creating enthusiasm, maintaining knowledge base on the part of legislators and other stakeholders around the impact of evidence, as well as developing data systems, which we're working on, to be able to demonstrate that these evidence-based practices are having an impact on the areas on behavioral health, child welfare, and juvenile justice.
Great, thank you. And David, could you talk to us about the lab at DC in your role, please?
I had a feeling you might ask that next. Well, it's a pleasure to be here with y'all. I'm David Yoakum, the director of the lab at DC, which is in the executive office of Mayor Muriel Bowser here in the district. I think for purposes of our discussion today, it might be a somewhat unique example of some structural and even approach types of changes we've been trying to make kind of in the bureaucratic weeds to put some more meat around this bone of an idea of evidence-based policymaking. And so from a structural standpoint, we actually have a team of about 15 to 20 scientists who are district employees based out of the Office of the City Administrator. So think individuals with graduate level backgrounds and experiential backgrounds from fields like mathematics, sociology, anthropology, cognitive psychology in my case, coming from a mixture of academia, government, nonprofit, industry, somebody from the military, and coming from different levels of their career, everything from someone finishing up graduate school to a dean of a medical school. And so a pretty diverse mixture of perspectives, connections to communities of practice, even just approaches that they take. And this is by design to give us a little bit of flexibility to meet the really diverse amount of problems that government, of course, has to deal with. The other structural thing is that that kind of hub of individuals I was just describing spokes out, if you will, to scientists across district government, of which here in the district, but this is true of most governments across the country, there's an amazing quantity of talented people, often with scientific chops you might not realize, but they're often disconnected. They're isolated. You know, you encounter data scientists who have a computer that can't run R or Python or something like that. And so we try to use the lab as sort of a platform for building this community of practice, knowing each other, sharing code, sharing ideas, and just facilitating the peer review and sort of participatory elements that are just key of doing good scientific work. And the other layer of spoken out is to universities and research centers in the community. And so we have a center of gravity inside of government that I think becomes a unique connection point for people that are at universities and think tanks and research centers that have wanted to try to help government do this type of work but haven't had necessarily the same amount of capacity in-house to sort of resonate with. We're trying to kind of fill that void. And so with this kind of structure I was just describing, the types of activities that we do are, on the one hand, of course, projects, actually trying to solve problems, right? So we've done things like the world's largest randomized field experiment to try to understand what impact body-worn cameras are having on interactions in the street between officers and residents, also how that video footage might affect downstream outcomes in the courts. We've got other randomized field experiments in the place trying to do things like implement a nurse triage line that might reduce on improper ambulance sends, playing around with how we might better design housing subsidies. We have kind of a different category of projects where we're taking the vast amounts of administrative data that the district has and trying to stitch it together, and then doing things like building predictive models to identify where rats are most likely in the district so we can target those little buggers, or identifying where housing violations, health and safety violations might be happening in physical infrastructure. It's kind of a whole category of things where government has scarce resources they need to prioritize, where we might be able to build models to help do that. We have things like a Formapalooza initiative, which is a high-level idea to draw on psychological science, user-centered design, to systematically redesign every government form, which is like the most common touch point we have with government. And if you've not noticed, we don't always design the most intuitive government forms. And so imagine a world where every form that you touch, whether it's paper or digital, is simple and easy to use in the same way that when you pull out your phone, you can just use it. How nice of a first impression that would be for government. So there's lots of projects like that and more in between. I'd invite you to go to the lab.dc.gov, where we actually have another link to descriptions of all the projects that we're working on, and depending on where it is in the stage of the project, pre-analysis plans that articulate what we're trying to do, and then ultimately, of course, the results of what we learn, because we're going to try to be absolutely transparent about every single project that we work on. So that's the projects, that's the left hand. The right hand is a lot of thinking and investment in how to actually change the bureaucracy to facilitate doing more and more of those projects, right? And so this is one where issues of what kinds of changes we might need to make in hiring, say, right? And so for those of you who worked in government, even just little things like going out of our way to have position descriptions that really tightly describe what we're actually doing, as opposed to just picking one conveniently off the shelf that's like close enough. I think my first job in government, I was like an IT specialist at the federal level. Not what I was doing at all. But those are the kinds of little bureaucratic things that set the stage for what you're trying to do. Procurement is another issue. How can we make changes in procurement so that if we're hiring a vendor to go out and do data collections, can we make it required that they give the data back to the state? Can we make it required that they give us the code back? It's crazy that we're paying for this stuff and then we're not getting it back. Budget is another big issue here. How can we actually sync the timing, the rhythm, the sort of information in a way that fits the bureaucratic realities of how quickly a lot of these decisions get made? And this is something that I think is both high-level structural things that are going to come from legislatures, but this is also a lot of bureaucratic weeds of looking at budget analysts and what their pace is like, and can we get these things in the right digestible format at the right times. There's more on building that community of practice that I was referring to. And so here at the lab at DC, we do things like the lunch at DC, a bi-weekly kind of speaker series where we put a lot of thought in bringing in researchers who have sort of innovative or basic ideas even, but try to facilitate the discussion in a way that's very tailored to what we're trying to do here in the district. Even just like little things, like if we're going to talk about education, let's go physically to the education agency so it's really easy for people to slip in. There are another thing we do called the podcast at DC, which is a podcast, another venue to sort of talk about the research. We try to bring it really down to home with concrete examples about how it might play out in a city. And so a lot of the examples are here in the district, of course, because that's where I'm at, but I think it's of relevance to anyone across the country because so many problems are kind of commonly shared. And my hope with that and the lunch is that talking about the ideas and then really getting in the weeds on how it might work specifically help make real some of the abstract concepts. One of the podcasts, by the way, is specifically on big data policing. It went out. And we talked for about an hour about what the state of the science is, some of the things that we know about what's working, what's not, privacy implications. There's another second part that's about to come out in a little bit where we actually have a similar conversation with the Metropolitan Police Department about what's happening here. And this is all meant to sort of stimulate a larger community discussion about how do we get these really complicated issues right. And I think it actually continues the trajectory of what we did on the body-worn camera study of not only trying to get the science right, but getting the I'll say politics, right, but in the sense of these are often really big value judgments that are embedded in this. What kind of privacy things do we want to weigh or not? It's not a scientific judgment. That's a political judgment. And so we need to do the science in a way where you have these value judgments to plug in. We build processes to do that. And so anyway, there's a lot of projects. There's a lot of capacity building. Maybe the last thing I would say is I'll again invite you to lab.dc.gov and to be a part of this. So we're in the district. I bet a lot of you live here. This is really meant to be a platform. We're going to be putting out calls for if you might want to work with us, like literally we're about to start hiring. But we also bring in people to work on ad hoc projects. And so if you go to the website, you can sign up for the listserv and do that. Last thing I'll say is this all came online after 2015, so after the report. I'm just saying, once you do the next one, you might need a color other than blue to sort of designate what we're doing here.
Thanks, David. Nice, good pitch there. So you've really built the lab at DC from the ground up. You alluded to some of the challenges, but could you talk about some of the key challenges you faced with accessing data?
So there's a lot. And it depends on the agency that you're at. I think it's rightly been alluded to that the technical components are variable, by which I just mean how good the system is from an IT standpoint is variable. And this is a space where we know how to build integrated data systems from a security standpoint, from an IT standpoint, but the history in any particular agency might get slowed down on doing that because they don't have the money. Or maybe they have the money, but they're locked in to a series of contracts that are difficult to kind of unlock at the right timing so that you can actually procure or build something that's proper. But there's a whole other category of one that I think a lot about. I actually gave a whole talk on it. I think it's like online now, of just kind of the psychological challenges of sharing and using data. And it includes, I won't try to go through all of them, but it includes things like, for instance, sometimes when agencies are nervous about sharing data, it can be easy if you're on the outside and haven't dealt with administrative data inside of government to think, why aren't you willing to share? Are you censoring something? What are you afraid of? Just give us the data. And I think what often gets missed here is internally, administrative data has typically a tremendous quantity of quirks, just weird things. Like it wasn't data sets that were built for research purposes. And we often live in a world where the administrative data isn't documented in a way to facilitate research. And so people have legitimate concerns that if they just pass the data set out, it'll be misused. Researchers will work with it and literally make wrong conclusions because they don't understand the process that was generating the administrative data set. And so the right way to do this, of course, over time is to try to fix the quality of the data, do a lot of documentation so that you can explain to researchers what to do. But both of those things, you can see how that's no longer a quick, oh yeah, I'll email you the data back. It's, I need now, as a bureaucrat, enough time to invest in building all of this documentation and process. Until I'm able to do that, I can't responsibly share the data with you.
Right. And Jessica, you spend your energy synthesizing information for decision makers.
Yes.
Could you talk to us some of the challenges you face in translating that information for decisions?
We have so many challenges on so many different levels. I don't want you to be fooled by thinking this is like such easy work, let's just all dig in, but it's all worth it in the end, I promise. But as far as challenges are concerned, sometimes that's just a product of where I sit. Like I said, I'm part of the governor's office, state planning and budgeting. So sometimes that's just, how do we define evidence? We're synthesizing this information to present programmatic information on what do we know that's effective and evidence-based in our state. Our office has a definition for what that means, but that does not always translate to agencies and what state departments identify as evidence. We know that there's levels of evidence, right? Like there's good evidence, there's maybe some bad evidence. Evidence to us typically means rigorous clinical trials. Evidence to a department might mean Johnny's cousin's brother's sister went through a program and it worked, so of course we're going to do more of that. So it's just kind of speaking a common language and having a standard. In Colorado, we haven't necessarily been able to do that. We've tried a couple of times to pass legislation around what does evidence-based mean. Actually, one of our legislative staffers went through statute and found 86 references to the term evidence-based, and nowhere is it defined. So we live in this place where it literally means everything and it means nothing at the same time. So when we're out there in the budget world and saying, we have new budget instructions, we want you as a department to submit your your request, and we want you to just say, this is the evidence that supports our program. We want you to create a plan for evaluation and implementation. We're kind of asking them to define it for us, and then we're assessing it, which creates a little bit more work for us, which we're happy to do. But at the same time, if we had that consistent definition, if we had that standard, we could talk to agencies a little bit easier. We could talk to legislators a little bit more easier. It would be kind of a level playing field that everybody would be starting from. But as we talked about with data and privacy and some of these different things, there's a lot of fear built into this work. People don't want to kind of expose their program, open their program. What if it's not working? What if it's not working how well we wanted it to? You know, we try to talk about, well, what is it evidence-based for? Are you looking at specific outcomes? We want to make sure that we're not creating harm like we talked about, but there is a lot of fear in this, people exposing their information. You know, if it's not evidence-based, is it going to be cut? Is it going to go away? So it's a lot of kind of having these conversations, assuaging these fears, getting on the same page with folks. I think a big part of how we've addressed that challenge has been around the outcomes. We have a lot of conversations around, you know, what evidence-based means to our office and what evidence means to another office, but do we actually have evidence to support that the outcome that you're interested in is actually being supported? And so talking about it in terms of outcomes has been pretty helpful for us, but it still remains a challenge as far as that standard and that consistent definition is concerned. But we're still up to the challenge. We're tackling it every day. So.
Great, thank you. And Eric, we often talk about evidence-based policymaking at a really high level, but less frequently kind of really getting into the details and understanding the processes and inputs of evidence. Could you talk about some of the legislation you've worked on, maybe one example, and what the impact's been and how it's been beneficial?
Yeah, I want to comment on, before I get to that, convincing legislators and legislative staff that there is evidence that has a positive impact on outcomes for kids in juvenile justice, or a youth in an out-of-home placement, or a child with a serious mental illness, often is, and historically in my experience, is incredibly challenging because it flies in the face of what they see and what they hear about. So it's taking the time over the course of long periods to really show that there is effective ways of bringing about positive outcomes, and particularly using the people who have experienced those outcomes, has often as much credibility as any data that we've been able to. Yes, we have to have the credibility of the data, but actual personal stories about how this program has had an impact, has had a tremendous impact on legislators being able to overcome their biases around these issues. So as it relates to legislation, the legislation that requires our state to, in child welfare, juvenile justice, and behavioral health, to use the identified programs on this inventory, we've seen a significant increase in the implementation of evidence-based practice, and we can document it on the basis of, we have developed a way of ascertaining whether they're actually doing these in adherent ways. Only some of these practices have built-in adherence and fidelity measures, but we've worked with the provider community in helping them to use tools that actually help them in terms of defining clinical outcomes and helping to guide them in making implementing these programs. So the data actually exists. We've been able to show year by year by year the increased use of evidence-based practices, decrease in emergency room placements for kids with serious, decrease in number of kids going into secure juvenile facilities as a function of getting specific programs. So we have we're access to data that actually demonstrates the effectiveness of this. It's built into the legislation as well. We had it built into the legislation that there needed to be ongoing evaluations and outcomes around this
Great
project.
Before we open it up for questions, David, can you tell us about one of the most pivotal or biggest successes you've had?
Well, that's a nice invitation. So from a structural standpoint, one of the biggest things that's happening right now is we're actually shifting to permanent funding. And the investment like this into something like the lab at DC and the structure and the people I was talking about is a very serious commitment from Mayor Bowser and from everyone else at the leadership at the council that they mean business here. And we start off with sort of generous funding from the Lauren John Island Foundation, thank you all, but this is something that we need to be investing in as citizens. It is very expensive not to spend money on research. And I think as a proof point and making that sort of the case for that is something that's hopefully going to start to replicate at jurisdictions across the country so that we just invest more in this capacity sort of directly. The other thing I would say is that I view a lot of our approach as, or my thinking on this has shifted a little bit away from trying to convince decision makers, here's a piece of evidence that you need to pay attention to a little bit more of a conversational approach around what's a problem you're trying to solve that if we could provide answers to certain questions, you would spend money differently, you would staff differently, and then going back and tailoring research agendas to that. And maybe there's a paper that's out there that we can come back with, but it's one where we're sort of shifting the posture away from like convincing people and more about tell me what you want to do and we'll sort of empower you with information that's out there. And so places where I get excited on some of our project examples are ones where we have tailored field experiments to answer a question that was jointly identified in advance with the actual decision makers, and they've bought on to act at a function of it, and then we've done the study and then they've turned around and scaled it. Even if it's a small thing, like let's do a improvement on the paperwork that people on TANF use to stay enrolled in the program, which we did, and showed that a particular redesign kept many hundreds of families that were eligible in the program, and then turning it around and scaling that, now many hundreds more families that need this benefit are keeping on it, is a concrete momentum of a proof point of this approach that's now starting to be talked about across district government amongst employees and replicated, and that excites me a lot.
Great. And Jessica, could you briefly talk about an example where your office has used evidence to really make a meaningful difference?
Yeah. So during our first dive into the results first model, as I mentioned, we were mandated to look at adult criminal justice, juvenile justice, and child welfare. So since we were mandated, that meant that the department had to work with us. So you can imagine that maybe they were a little less excited. Like I said, there was a little bit of fear around this already, and now they're like, okay, now we're already scared about it, and you're forcing us to go into this project with you. So during that time period when we were going through our program assessment, we worked with our Office of Community Corrections. Community Corrections in Colorado is actually our halfway house system. So in working with the office, when we did our program inventory, we actually identified that every program that they did in the Office of Community Corrections was not only evidence-based, but it was effective and evidence-based, which is a home run, right? Like no other office, no other department had did this. They could say, look, we do all the evidence-based programs. But what we would have expected when we ran through the model that we would get all of these cost-beneficial programs as a result is that none of their programs, other than their standard residential treatment program, showed to be cost-effective. So there was kind of this, well, we have all of these evidence-based and effective programs, why are we producing a negative return on investment? And so when we did a deeper dive, they really looked at their internal data and said, our escape rates are really high, our recidivism rates are really high, our program failure rates are really high, like something is not matching up here. And the other thing they noticed is that over time, their population had really changed from low risk. When you think about community corrections, you know they're trying to serve these low, moderate risk populations. But over the past decade, they were serving 85% high risk folks. And so the programs that they were offering were not matching their population needs. So when Eric talked about, you know, are we really matching these programs correctly? They were not. So their specialized treatment programs weren't matching those population needs. And they said, you know, we need to go back to the drawing board. We really need to find a program that matches their needs for these high risk offenders. And we were able to get them funding for a pilot program. We went back to the research and said, hey, there's this great cognitive behavioral therapy program that seems to match with the population that you're trying to serve. We were able to utilize the model to run predictive benefit cost analyses and say, if we were to implement this based on our assumed startup costs, we're actually looking at a positive return on investment. We took that to the legislature and the pilot was funded. The great thing about this is that, as I mentioned through this process, everyone was terrified that all of their programs were going to be cut. And so we didn't cut any programming. We just diverted funding from the unused beds in the specialized specialized treatment to fund the new pilot. So those programs are still available to the appropriate population, but from those unused beds, we're able to utilize that funding to support this new program. The pilot is just wrapping up, and we're hoping that we'll be able to scale based on the information from the pilot. So it really just highlights our right services for the right people at the right time and in the right way when we're thinking about implementation. And it really makes us recognize that, we can be doing a better job, and we need to be looking at the types of programs and services we're delivering. So
Great, thank you. There's clearly a lot to discuss here.
Yeah.
Let's go ahead and open it up for questions. Are there any questions? We'll bring you a mic.
Hi, my name is Grace Levin. I work at the Department of State. And this question's for you, David. Thank you for explaining that a lot of your research is tailored to decision makers' needs. I imagine that there's some of that, and also you kind of discovering issues through data and evidence that sort of just happen naturally. What happens after you've identified a problem and potentially proposed a solution based on your data and evidence to a decision maker, but they maybe don't have the staff or resources to go and implement the solution? Or, do you run into situations where you've, got this great idea, this great program potentially proposed, but it doesn't go anywhere? I mean, what does that process look like? Where do those ideas go?
No, it's a great question. I mean, for me, it goes back to investing a lot more than we typically do on the initial problem scoping. Like, what is the thing we're actually trying to solve, and what does a solution look like that is both effective in a technical sense, but also implementable in a political and operational sense, and tailoring it around that. And so there's a couple of layers I could take. I mean, one is if we know we're going to be constrained over the coming years to a certain set of staff and budget, maybe it moves a little bit, then we need to design something that's going to fit that. And so if we're talking about a reentry program or something like that, maybe the perfect intervention is going to cost $100 million, but if we only have $20 million, we need to figure out whether there's something in between that's closer to that. This happens all the time, by the way, when academics and stuff send papers like, just do that real quick. It's like, yeah, we can't. There's another layer, though, that is, for those things that seem really, really promising, having the sync. This is where the sync with longer-term planning and budget starts to come in, to where we are going to be learning things that we don't have the resources for now, but we need to do research in a way that is preparing to make the case with data, compelling stories, et cetera, to actually turn around and invest in things that are going to be more expensive. But that takes time, and I think the style or the nuance here is to not do the research and then start talking to the people that are going to be responsible if they scale. They need to be at the table on day one, and a key part of talking about what it is we're trying to do.
Great. Other questions? Right here. Mike's coming.
Hey, how's it going? I'm Matt Leonard with Government Computer News. I was hoping that you guys could talk a little bit about sort of the technology side of this. David, you mentioned it briefly. You said we know how to make these integrated data systems, but if you could just talk a little bit about how you guys have gone through that process at your states or in DC, that would be great, and any challenges you might have faced when building up those systems in order to get it from that administrative data that can be kind of sloppy and not necessarily for research, and then into this data that can then be used to create evidence-based policy.
Thanks for the question.
Yep.
We're very fortunate to have a shared database within our social and health services, juvenile justice. So we can access information on outcomes for a youth, whether she or he is making use of Medicaid services, whether they're in and out of juvenile justice settings, whether they've been charged with some crime. So there's an integrated database that allows us to really ascertain outcomes in various domains. So that is a very, very fortunate circumstance. So when we think about outcomes and someone says, well, is this kid going to school? As a outcome of whatever the intervention rather than whether they're feeling better about themselves. We have access to that kind of data. And it's, in fact, that kind of pragmatic, practical data is very, very much more convincing than some change on a scale or on some assessment.
Yeah, my point with that was that there are very good secure integrated data systems to be found in examples of things like state longitudinal data sets, but also just look at private industry and places like that. So from literally a technical standpoint, we know how to do this. I think where we get stuck in the mud are some of the things I was alluding to a moment ago about getting the right rhythm with how to figure out how to unlock the contracts, how to get the budgeting right, and so on. And maybe the one thing I would use this moment to say here is that I think we've tripped ourselves up, or at least I've seen it trip ourselves up when we're making this case by sometimes focusing too tightly on just investing in a data system for a data system's sake. Other than like scientists and data scientists, nobody like cares about data per se, right? What they care about is some problem. And so I've shifted a lot the way I talk about this and think about it of we're trying to solve a problem. Oh, and by the way, while we're trying to solve that, one thing we're going to need is just a means. Like, we're going to have a little data. We need a little data system. So like while you're investing towards this problem, like I just got to build a data system real quick. And that is probably the right way to think about it, And we don't always do this. Like people ask for data all the time without having clarity on what they're going to do with it. So that's something that might give us more progress on the budget arguments, I think.
And in Colorado, in our office, we haven't tackled that particular challenge head on, but it is one that our Colorado Evaluation and Action Lab is trying to tackle because they're trying to do these rigorous research projects. They need access to a lot of different state data. So for example, one of the projects that they're looking at is focused on super high utilizers. So how do different systems define what high utilizer means to them, and then how do we more properly target things like housing vouchers to those that are in need, or coming out of the criminal justice system, whatever that looks like. So they're really focused on addressing that. I think the problem that we face is around, again, fear, and it's all personally identifiable information, and how can we put that out there? And the default is to find all the answers as to why we can't share data, but we're trying to switch that conversation to the default is yes, but what are these sort of hiccups, things we have to think about? And so they're really focused on data linking versus data sharing. That's kind of the language that we're using in terms of how do we share, or how do we link it, and not necessarily you're getting all of this personally identifiable information. So kind of thinking about it in a different way. But that's a lot of the work that the lab is taking on.
Great. We have time for one or two more questions. If there are some. In the back, what there?
Hi, good morning. My name is John Cobb. I'm with Department of Homeland Security. I'm curious, how do you work with stakeholders outside of your state, or especially here in the district with all these Virginians and Marylanders and other people? Just curious what your how you work that.
Would be you.
Yeah, well, Virginians and Marylanders are lovely people. Everybody's welcome. So, yeah, a lot of the problems span geographic boundaries, and so we need to coordinate. I think we're at a stage right now where lots of our projects are staffed up as best as we can, and we bring in people from all kinds of places to collaborate on our project. We don't have like a super formalized yet way of doing this. We're kind of building towards that a little bit just for efficiency's sake. But in the meantime, if you look at a lot of the projects that we have on our website, lab.dc.gov, you can find people that are working on the project. You'll notice that they're a mixture of central kind of lab staff, people at agencies, other academic or nonprofit partners that are on there, and that just emerges through kind of finding the right people at the right place. The other thing I would say is that for many of our projects, this is going back to what I was alluding to of doing a lot of kind of community engagement to scope out what the problem is and to start having discussions about how we might try to tackle it and setting expectations about what we'll learn and what we'll not. And so the body-worn camera study, for instance, that I mentioned, before we ever started to get into the data at all to look at what it was telling us, we wrote a very detailed pre-analysis plan, or kind of a description of the method that we were going to use in advance, and we publicly registered it. And this is good for research integrity purposes, so you don't get in there and, torture the data to say what you want. But from a political perspective, it also gives a lot of forum for talking about, are we answering the right questions? What are the things we're going to learn or not? And we did about 12 different community events with people from police unions, with the ACLU, and a lot of other groups, with college students, with high school students. And then on the back end, when we had the data, similarly, we went out and talked about it. And I think this is a key part of the work to where ultimately Like in some sense, ultimately, the people that really need to buy into this are all of us, right? Not just policymakers, but the really ultimate leverage over political people is political pressure at the voting booth that if you are doing something and you're not using data and you're not running field experiments, I'm going to consider you an irresponsible politician and vote you out of office. Like that is the ultimate win for this movement, to my mind. And we need to invest, I think, in a lot of this community discussion to get there.
Anything to add on stakeholder engagement? Go for one more question. Yeah, right here.
Hi, Christy Schlenker, USAID. So David, you've talked about this a lot, but I'm curious to hear everyone's take. How do you find the right balance between what sort of capacity you need in shop versus when you're contracting out or working with a think tank or local local or national sort of universities, either nearby or somewhere else?
As part of the legislation that was designed to implement evidence-based practice, there was a resource that came both to the Institute of Public Policy and to this Evidence-Based Practice Institute to carry out these kinds of activities. If you're asking how much, I'm not sure how much, but in order to be able to credibly report back and work collaboratively and engage the different stakeholders, there needs to be an infrastructure that's supported and has consistent support and that's credible. In the initiation of this evidence-based practice, it was clear that the legislators didn't have a great deal of trust in the data that was coming from the various departments around effectiveness. So bringing an outside entity, be it a public policy institute or a university, into the mix really enhanced the credibility and belief in data. And I'm not sure I'm answering your questions about capacity, but certainly having external voices around how data is looked at and how credible it is certainly has an impact on ongoing support and sustainability.
Mm-hmm. Yeah, I mean, we talk all the time, even though I am the resident research and evidence-based policy initiative person in the Governor's Office of State Planning and Budgeting, and I have a teammate, we're only 2 people, and we say all the time that evidence-based policy is not just a function of our office, it's a function of every branch of government. It's the state agencies, it's the legislature, it's nonprofits that work in our communities, and so we've actually done a lot of stakeholder engagement outreach, and we've formed kind of this organic EBP collaborative, which consists of our office, people from state agencies, people from universities, people from nonprofits, and we kind of all are out there talking the talk. And even though we don't have this state standard of what that means, right, we all kind of have our piece to play, and we have our piece in the puzzle, and we're always plugging into different people throughout our networks and our communities, and so we've kind of naturally built that capacity, but it definitely takes more people to do the work.
Yeah, what I would say is the ultimate quantity of resources and what the breakdown is between in government, contracting out, universities, nonprofits, I'm not really sure. I think as a general rule, I would say we need a lot more of all of those, and a lot more investment on the in-house government side as well. These are not mutually exclusive. This is my earlier point that if we get that right, the other elements are just going to be better leverage. There's going to be more to sort of facilitate. The other thing I would say is that, we've talked a little bit already about some of the bureaucratic changes that need to happen. I think there's a similar conversation that needs to happen on the academic side. And so whenever I put my other shoe on and I'm talking to my other faculty colleagues, I think we as academics underestimate how much our research, our inventiveness, is going to be improved by going out into the field. This basic versus applied distinction that people make, I think, is way overblown. And what I would say to academics is just study the history of science to make this point. Look at World War II, look at Bell Labs, look at all of these different periods. It's a space race where there are highly implied endeavors that to solve them, we had to invent so much stuff. So I think it will be good for scholarship too, but that's going to require some changes at the university. And so we should have that conversation jointly.
Great, thank you for your thoughtful questions. To close out the panel, I'd like to start with David, and just in a kind of rapid fire response, if you will. What are the top 2 or 3 components to advance the use of evidence and data at the state level?
Oh. Well, we've said a lot of them so far.
Yeah.
I do agree with Sarah's point that everybody, no matter where you're at, can just start asking this question, do we know this works right now? And really pressing on the what's the counterfactual? So in government, it's always common to be looking at metrics over time, and that's fine if you're doing a pre-post thing, but pressing people to clearly say what would have happened had we done something differently, if just everybody says that always, everywhere, that alone would be like a nice little culture change.
Yeah. Eric.
I think figuring out ways in which to support the implementation of evidence-based practice. I think that it's a resource issue, and many of our funding schemes and the structured Medicaid and the Title IV are not really designed to support these activities. So coming up with strategies to use federal and state dollars in more flexible ways.
And Jessica.
They took my 2 answers, culture change and funding.
There you have
Big
it.
things, yeah.
Great. Thank you. Thank you so much. And please join me in thanking the panelists.
Well, thank you all for the great discussion just now. So I have to say, I'm actually pleased to hear so many questions from folks who work for the federal government in a conversation about states. So it's just a good example of cooperative federalism in practice. In reality, we know there are a lot of states that are intricately interested in moving this topic forward. You've just heard from 3 great leaders across the country. Kira was actually just at the National Governors Association summer meeting last week, and innovation and issues around data use were recurring themes that came up throughout the event. So from the top level of governors' leadership all the way through the folks that are sort of on the ground doing some of this work, we know there is a lot of work to be done, and maintaining the interest in the topics is going to be really important. I would like to stress that this is hard and takes time, and I think these folks have sort of highlighted many of the issues, and Sarah's research has highlighted many of the challenges that states face in going forward. And what struck me in the conversation today is just how similar some of these challenges are at the state level to what we see at the federal level. And not to plug the Commission on Evidence-Based Policymaking too much, but I think a lot of the recommendations that the Commission highlighted at the federal level are just as relevant at the state level, and would really encourage that we think about that application going forward. I want to highlight one thing before you all walk out the door. What can you do? You've heard a lot of suggestions through the discussion today. I think there are a handful of things that came up multiple times. Ask questions. Does this work? Collaborations and partnerships are going to be really essential, and that may require us to change the models that we use for implementing some of our programs. Encouraging policymakers to actually develop the policies and practices to support this work and the basic infrastructure to engage in evidence-based policymaking. If you find a good leader, don't let them leave. David, I hope you don't ever leave the DC lab. I'm sorry. Developing communities of practice, making sure that researchers and people who are interested in this topic are connected across government agencies, nonprofits, is essential. And being able to explain what the heck we're doing is really important, whether it's developing stories or cases or just a narrative that is accessible. These are all really basic strategies that we can engage in today, and I encourage you all to begin to do so. If you'd like to learn more about the Bipartisan Policy Center's work around evidence, I encourage you to visit our website, bipartisanpolicy.org/evidence. I'll just put in one last plug for David's website, thelab.dc.gov. All right, I got it right. And I just want to say thank you to all of our panelists, and to Pew for co-sponsoring this event, and to all of you for joining the dialogue. Let's keep the conversation going. Thank you.